Hi, Dr. Baumholtz. I want to take a minute and go through your post-op care bag. You're all going to get one of these after your surgery, and let's just go through what's in it. Yours may have some slightly different brand names depending on the supply chains and what I can get, but they'll have these components to them, and let me teach you how to use them. Okay, first things first is your DVT machine, and this is what we're going to have you wear until you're walking normally. You'll open the package, and let's just go ahead and open it all the way. Who doesn't like unwrapping things? Okay. Now, again, depending on supply chains, yours may be a little bit differently, but effectively you've got a stocking that you'll put around your leg with the Velcro, and so you put it down around here. I don't know if you can all see that. First things first, take off the plastic, and then if you can charge a cell phone, you can charge one of these, but the charging port is off to the side. Again, different brands may have different requirements, but you'll plug that in, plug it into the wall, so that if you're stationary for a prolonged period of time, have it charging, and then when you're out and about, take it off. You only take these off while you're in the shower or when you've resumed normal walking, all right? So whoever gets this one next, it's not used, it's just the one we used for the demonstration. I hope that's okay. But like I said, the brand may change from time to time. All right, so that's that. Next. ABD pads, bonus points for anyone who can tell me what ABD stands for. It's not abdomen, but what you'll notice when you take your dressings off is that across your belly, this incision, and then the drains will be coming out on either side. So when we tell you it's time to take a shower, all of those dressings come off. You take your shower. At the end of the shower, with whatever you normally wash, and I want you to wash this area again with Dial antibacterial soap, and then you're going to need this tape. Whoops, I try not to throw it. As I throw it, you're going to need tape. You're going to need this Xeroform. You are going to need a pair of scissors, and then you're going to need the gauze. So let me show you what we'll do with it. So believe it or not, it's actually easier to cut this while it's still in the package. So you can get a feel for it, but basically what we're going to do is we're going to cut it. We're going to make strips out of it. And you really only need to do this once, right? So your first shower. And then what you can do is you'll open this up, and it's a yellow impregnated material. It's got antibiotic material built into it. So how this works, you're out of the shower, you pat things dry, you open this up. I will get sticky and greasy for you because that's how committed I am. And you open this up, and you're going to lay it down over your incision. Okay. Next, we're going to take this ABD pad, and we're going to take it, and we're going to do a couple things. The first thing we're going to do is we're going to lay it 1, 2, and then the ones on the side, what we want to do is we're going to take, again, our scissors, and we're going to cut a slit so that if the drain is coming out of our body like this can go around it, and then it's in place. Last, we take our fancy tape, and this is very, very skin friendly, and we just go very gently above all of that bandage and then below, and that's it. So that's your dressings, and you'll have enough tape and gauze to last your post-operative period. Once you are done draining, and you'll pretty quickly stop draining from the front, then what I want you to do is you'll just be protecting where the drains come out, and for that you can fold it a little bit differently. Fold it like this. Same thing, we're going to make a little window or a little crotch. We put the drain through that, and then we take our tape and we tape it. Okay, all of that minus the scissors is in your kit. If you're using scissors out of the kitchen drawer, put them through the dishwasher first or wipe them with alcohol and make sure they're clean. Other than that, that should be helpful. All right, take care.